In today's Blissful Beauty segment, do you have parentheses like me? Laugh lines. Amanda Gallagher, nurse practitioner at Glow to Be Med Spa here in Raleigh, is joining us to talk about derma filler. I've seen commercials about it and in the magazines. Does it work?
Oh, dermal filler is wonderful. I use a product called Juvederm, and basically what that does is it's a dermal filler, and it goes in and actually plumps up and restores that loss of volume.
Okay, so it's going to go into the deep creases?
Exactly. Today we're going to put it into the deep kind of folds of Amy's tissue. You can put your chin up.
Now, what you do have something on Amy's face right now. She didn't just eat powdered donuts.
I hope not.
We were joking about
she
before.
hasn't. She hasn't. Basically, this is a little topical lidocaine cream, so she's going to get a little bit of numbing from it, so that when we go ahead and do the treatment, she really will feel not much at all.
Okay, all right. And is this, when will she see an effect? Is this in a few days, in a few weeks?
Oh, it's wonderful. It's instant. So today, yeah, it's instant gratification.
Oh my gosh.
It's not like weight loss or anything else that we do.
It happens
we can go
immediately.
in, we add the volume, and she can go home looking more youthful and restored.
And you said this is only something you have to do maybe once a year?
Yeah, once Amy gets to her level of correction that she's happy with, this is a treatment that she'll touch up once a year.
Wow. Okay, so
or maintain
let's get
once a year.
started. Yeah. It's a needle?
It's a needle, so I'm going to go ahead and put some gloves on and wipe down her face a little bit.
Is this a procedure that is different than Botox in that it's not at all the same agent? It's
Yes, this is
completely
completely different. So basically the Botox, as we talked about earlier, works in the muscle. And this, of course, works as a volume filler.
It's just going into the tissue.
Into the tissue,
Okay.
exactly. You can see this, she's starting to get an oral commissure through here. They call them the marionette lines. It's a puckering of the skin. So as we restore volume through here and through here, it's going to gently raise this cheekbone up and give her a more youthful look. Basically, back to where she probably was a few years ago.
Okay.
Okay.
Now, these sort of wrinkle issues, they are more of a genetic thing rather than a sun damage.
It's a little bit of both, actually.
Okay.
Yeah. Certainly people who worship the sun and don't wear sunscreen early on and into their 30s and 40s, it breaks down the collagen so that you're not making collagen, it breaks it down. And when you break down collagen, guess what? You get wrinkles.
Get wrinkles. All right. So this derma filler is basically a synthetic collagen.
It's not a collagen, it's a hyaluronic acid. And basically what that is, it's going to go in and it's going to add that volume back. Hyaluronic acid holds thousands of times its weight in water. So it attracts water and it holds it. So things will stay nice and volumized and full, and it stays put, which is nice. We're just going to go in here, and I'm going to, nice deep breath, Amy. There you go, good. We're going to restore this volume in here. And she can get a little bit of bruising from this. She can get a little redness that will last. The bruising can last anywhere from 3 days to a week. You know, a little swelling and irritation today, certainly. But she can go about her daily needs, go to work after, put a little bit of makeup on.
Amanda has finished on one side of Amy's face, and she's going to continue on the second side. We'll have some before and after pictures on the website. Just go to mycarolinatoday.com and click on Blissful Beauty. Thanks, ladies.
Oh, thank you so much.